This is the anatomical position of this heart. Now we will see the interior of right ventricle. See, this is the right atrium which we have discussed in this heart. Now this is the view which we go from right atrium to right ventricle. So if you go like this, here we can see one orifice. This orifice is atrioventricular orifice. This atrioventricular orifice is guarded anteriorly by anterior leaflet, then posteriorly by this leaflet, this one. Okay, this leaflet is posterior leaflet towards the interventricular septum. See here, this is interventricular septum, so it is present towards that. So this is septal leaflet. This leaflet is septal leaflet. So this valve is tricuspid valve. It is guarding the atrioventricular orifice, right atrioventricular orifice, right? Then if you wanted to say little about the cusp, this is the cusp, anterior cusp. If it is anterior cusp or anterior leaflet, it is having attached margin. See here, it is attaching to the fibrous ring of fibrous skeleton. Fibrous ring of fibrous skeleton. It is attaching to the fibrous ring of fibrous skeleton, and it is having free margin. See, this is attached margin and it is free margin. Is it? And it is having two surfaces also. One surface it is present towards the ventricle. This is ventricular surface, and this is the surface which is present towards the atria. This surface what we are calling atrial surface. So if you take single leaflet, it is having attached margin, serrate free margin. Serrate means what? It is like sawtooth appearance. See here, this is serrate free margin, and it is having ventricular surface and also atrial surface. If you see free margin and the ventricular surface, there will be attachment of so many cord-like structures. See here, so many cord-like structures are there. See, threads. So many thread-like structures are there. These threads what we are calling carda tendinae. Carda tendinae. These carda tendinae connecting the leaflets to the papillary muscles. See here, these are the papillary muscles. Here one papillary muscle, and here one more papillary muscle, and here small nipple-like projections also there. Very simple. Leaflet having the attached margin, serrate free margin. It is having ventricular surface and atrial surface. Ventricular surface is rough, atrial surface is smooth. See here, atrial surface is smooth, ventricular surface is rough, because it is giving attachment to the carda tendinae, and it is having the free margin, serrate margin. That serrate margin also giving attachment to the carda tendinae. Carda tendinae are nothing but they are thread-like structures. These thread-like structures are connecting the free margin of leaflet and also ventricular surface of leaflet to the papillary muscles. This is papillary muscle. In case of right side, see here, this is anterior leaflet. This is anterior leaflet and attaching to the anterior papillary muscle. Then I am reflecting this. This is posterior leaflet. This one. This is posterior leaflet attaching to the posterior papillary muscle. Okay, and this one, this is septal leaflet. Septal leaflet is attaching to the not single muscle. It is having so many nipple-like projections are there. These are what we are calling septal papillary muscles. So in case of right side, we can see anterior papillary muscle, posterior papillary muscle, and septal papillary muscles. This is about the leaflets. Now we will see interior of right ventricle. Okay. In case of interior of right ventricle, we can see rough inflowing part. See here, from right atrium to the right ventricle, if blood goes like this, here this part is inflowing part. This part is inflowing part. This inflowing part shows so many muscular ridges, bridges and pillars. So many muscular ridges and pillars. Because of that, this inflowing part is very rough. Rough inflowing part. Then, if you see here, this part is going up into where? into the pulmonary trunk. This part is smooth outflowing part. Smooth outflowing part. Right? So, in between the rough inflowing part and smooth outflowing part, there will be one crest. There will be one separating crest will be there, or one separating ridge will be there. That crest, what we are calling supraventricular crest. What is this? Supraventricular crest. So that supraventricular crest is separating the rough inflowing part with the smooth outflowing part. Then rough inflowing part contains so many muscular ridges, bridges and pillars. Ridges means small elevations. Bridges means they will be connecting one part to the another part. The important bridge is moderator band. Moderator band we can also call as septomarginal band. Moderator band or septomarginal band. What is this septomarginal band? See here. Anterior papillary muscle is here. Okay, this is anterior papillary muscle. Actually, they have cut here. This is anterior papillary muscle. And when we keep like this muscular bridge, which is connecting the interventricular septum to the anterior papillary muscle. This bridge, what we are calling moderator band or septomarginal band. Moderator band we can also call it septomarginal band. What is the function of it? It prevents the over distension of right ventricle. It prevents the over distension of right ventricle. And it contains right bundle of his. You know the right bundle of his, it's a part of the conducting system. So it contains right bundle of his. So this is about the bridge. Then what about pillars? Pillars are papillary muscles. See here. In case of right side, anterior papillary muscle, posterior papillary muscle and septal papillary muscles. So these are about the muscular ridges and pillars. So in case of ridges, just remember some elevations are there, those are ridges. Bridges will be there, they connect one part to another part. The important bridge we have to remember is moderator band. Okay. Then pillars means papillary muscles. Anterior papillary muscle, posterior papillary muscle, septal papillary muscles. So that is about interior of right ventricle. After studying the right ventricle, left ventricle is very easy because almost same features will be there. It is also having the inflowing part and outflowing part. So if you wanted to show that, I wanted to show you the left atrium also. See, this is the left atrium. This is left atrium here. My finger is in left atrium. This is left atrium. See, this is left atrial chamber. This is, okay. This is left atrial chamber. Okay. This left atrial chamber opened by 4 pulmonary veins. 4 pulmonary veins. See here. Otherwise, you can see here. This is left atrium. No? Left atrium contains superior and inferior. Left pulmonary veins. Superior and inferior. Right pulmonary veins. They are taking the oxygenated blood from the lung and opening into the left atrium. Is it? So, this is the left atrial chamber. Okay. From the left atrial chamber to the left ventricle, this is the passage. This is the passage. So, this one is this one. This one is the atrioventricular orifice. Left atrioventricular orifice. This left atrioventricular orifice guarded by valve. That valve contains 2 cusps. See here. This is one cusp and this is another cusp. 2 cusps are there. This is one cusp and this is another cusp. This is anterior leaflet and this is posterior leaflet. Anterior leaflet and posterior leaflet. These are also having the atrial surface smooth and this is ventricular surface rough. And it is having the attached margin and also free margin. Attached margin here and it is free margin. And you can see the cord-like structures. These cord-like structures what we are calling chorda tendineae. These chorda tendineae connecting the leaflets to the papillary muscles. See here, this is anterior papillary muscle and this is posterior papillary muscle. And these are chorda tendineae. Here also we can see the rough inflowing part. Rough inflowing part means what? From the left atrium, see here, the flow will be like this, left atrium to the left ventricle. So this part is rough part. Then where is outflowing part? See here, from here, if you observe, see here, my finger is entering into the outflowing part and it comes out through the aorta. Comes out through the aorta. So this is smooth outflowing part. This is smooth outflowing part. Smooth outflowing part continues as ascending aorta. If you observe the thickness, see here, this is the right ventricular thickness. This is the right ventricular thickness. And this is left ventricular thickness. See, left ventricular wall thickness is more, 1:2 ratio. That means left ventricular thickness is more than the right ventricular thickness. What is the reason? Right ventricle has to pump blood only to the lungs. Lungs are present in thoracic case only. No need to work much. But in case of left ventricle, it has to pump the blood to the throughout the body. So it has to work more. Usually whenever we go to the gym and all, if you work more, the muscle bulk will be more. Hypertrophy of the muscles. So it is working more, because of that muscles become hypertrophied. So that muscular thickness will be more on the left side than the right side. And this is the septum which I am holding. This is the septum. This septum is interventricular septum. This septum is interventricular septum. So this septum will be like this. Septum having the superior and anterior surface, and it is having the inferior and posterior surface. It will be like this. And if you observe cross section, if you take the cross section of ventricles along the both ventricles, the lumen of the right ventricle is C-shaped or half moon shaped. But if you observe the lumen of left ventricle, it is circular. Like this it will be. Okay, I will draw here. It is like this left side, but in case of right side, it will be like this. Okay, it is half moon shaped. It is rounded. Understood? So these are the different features of ventricles. Only thing is left. In case of atria, see, this is the right atria, and this is the fossa ovalis, and this is the limbus fossa ovalis. And if you observe in the left side, the same impression will be present this side. That is fossa lunata. You can see light is visible. This is fossa ovalis. If you see from this side, see, this is from left side. If you see from left side also, fossa ovalis, you can see from this side. This depression is half moon shaped. That's what this fossa, what we are calling fossa lunata. This is fossa lunata. Okay, and this is fossa ovalis. This is fossa lunata. Okay, you can see the light passing through it. Is it? So these are the different internal features of heart. In brief, actually, I rushed.